or gel. So that is important. This is also we ask in the exam. Why do you use wetting of the skin before electrical stimulation? The answer will be to decrease the skin resistance. Okay?
Okay.
So we put water or gel. If more hair, okay, more amount of hair, then shave that particular area. Or if the skin is very thick, then you have to rub. You know the rubbing paper? Huh? But small, not rubbing to the paint, not like that. Smoothly you have to rub that area so that superficial skin will be washed off. Then you have to put the anode onto the treatment area, cathode on the opposite surface. Put a towel under that. Very fine. Can you give me the small stuff? Put the strap. Okay. Once this procedure is finished, patient is comfortable, his hand is resting, so he can keep it for 10 to 15 minutes, no problem. Once this procedure is over, then I will go to the machine, go to electrotherapy, all current waveforms. There is one separate high voltage. The heading is high voltage. Select high voltage. So there is high voltage continuous, high voltage alternating. Select high voltage alternating. Select whichever one or two, whichever you are selecting. Okay, select two. Then, no, sorry. High voltage alternating, second. Then select the time. Okay, 15 to 20 minutes. How much is the pulse frequency for high voltage?
High voltage
101 to 120. So you can put anything. Here hertz will be there.
Yes.
100 hertz, 80 hertz. For usually they put 80 to 100 as a good frequency. Okay? 80 to 100. Then go to the selection. You are getting the current? Getting? Now? Nothing? More? Decrease?
No.
Okay. So, as soon as he feels comfortable with the current, you stop at that particular place. Any of the currents, starting itself, don't give more current. What happens is, patient will get fear for the current than relaxation. So you start with small current. After 2 minutes or 3 minutes, ask the patient again. You are comfortable? No problem. Can I increase little more? No. Okay. If they say no, khalas. After 5 minutes, okay, again ask the patient. You are comfortable?
Yes.
Can I increase little more? No. Okay. No problem. Whenever he says okay, that time increase more. Okay. The idea is, the more current, the better will be the reaction of the skin. So it should be comfortable for the patient. At the same time, it should be more current. Okay? Any current, not only this. Any current, it should be comfortable for the patient, and at the same time, you should give adequate intensity. Very less intensity, effect won't be good. Okay? Your car, engine oil, you put 1 liter, you put 10 ml. Which will be good? 10 ml is good, engine oil 1 liter. Same. If current, you give 2 amperes, you give 10 amperes. 10 amperes will be definitely better than 2 amperes. But it should be according to the patient capacity. Patient should decide. Patient should be comfortable, then only increase. Okay? If you increase on the first visit, the next visit there is no patient for you. Please remember, on the first visit only, don't make the patient scared of your treatment. Tell them.
يقول إذا جاك المريض في أول مرة أول زيارة
لا تعطي جرعة قوية لأن ما بترجع لك.
They won't come to you again. Yes, it's common. But see, for example, you go to dental, the doctor has done so much of pain. You go to him again?
No.
Why? Because it's painful. This is common philosophy, common psychology of a patient. So don't hurt the patient. It's very important.
I treat him if he won't come about me.
Yeah, definitely. Okay? So this is about high voltage galvanic current treatment. So if for example patient says I am having pain here. Shabaz. Patient says I am having pain here. Then anode will go there. Opposite will be the cathode. Okay? If patient says I am having pain here, then anode will go there. Cathode will be backside. Okay, or next to it. If patient says I am having pain here, anode will go there and cathode not front. In front, electrical stimulation is avoided because here there is important carotid vessel and there are chemical stimulators for the respiration. So in front there is no electrical stimulation. In front of the neck, no electrical stimulation. Okay? Only the back or side. So one will be the back and one will be the side. Backache also same. One on the painful area, anode, next will be the cathode. Even leg. For example, if patient has knee pain. Okay? Patient has knee pain, that means anode, here is the knee pain. So anode is here, cathode will be here. Okay? If patient has muscle spasm means catch. Okay? Muscle is catch. So usually it happens in calf. Yes? Calf will go for the catch. Or thigh will go for the catch. So if it goes for catch also, anode on the catch area. Wherever the muscles catch, there will be the anode. Beside will be the cathode. Okay? But if the patient has edema means swelling.
Yes.
Okay? Then the treatment will little bit change. Okay? How it will change? Can somebody get me 3 or 4 pillows? Pillow means last room. 4 pillows. Very good, sir.
Where anode and the cathode?
For
فوق انون واللي تحت كاتب. اشرحها. He asked where
here up is the cathode, up is the anode and down is the cathode.
what say
Yeah. Anode has a positively charged ion. Huh? Anode. Yeah. Direct on the pin. For this machine, for this current. Not machine, for this current. Okay? Now, for treating edema, I have to decrease. Now can I increase little more?
more.
Okay, so that's what. After some time, there will be adaptation of the current. So you feel okay with the current. Then you have to increase. After 5 minutes again, you will adapt to the current.
Yes.
Then you have to increase. So not immediately, not suddenly. Okay? So that's what you have to understand the patient psychology.
You increase it.
Yeah, I can increase now. I'll put it another current. Now, when there is a edema, the edema means swelling. You want the swelling to go into the body, into the circulation. So, you have to elevate that particular area, whichever you are treating. So, for the elevation purpose, can you turn towards me? Turn. Go near to the bed. Okay. Little more? Little more can you come? Or that's it? Yeah, that's it. Relax. Relax. Or you want more support here? No. Yeah, like this. So you have to elevate. Okay, this is called elevation. Why to elevate? because the circulation has to go back to the body. If it goes back, then swelling will increase. So if dorsal aspect you see more swelling,
Yes.
okay, then you have to use cathode, okay, that is red cathode on the swelling, okay, and anode on the down, okay. So and you have to give the treatment, and he has to stay like this for 20 minutes. Is this comfortable?
Yes.
Okay. If for example patient says 20 minutes I cannot sit like this, then sleeping position, put the pillows next to the patient and elevate the arm. Okay. So if the question is in the exam, a patient with wrist edema, use high voltage galvanic current, and if you don't do this procedure, again I am sorry. Okay. If you keep the hand down and do the stimulation, I am sorry. If you don't choose the current properly, I am sorry. If you don't put the cathode on the swelling area, I am sorry. Don't ask me the marks after that. Okay, because this is very important. Without these pillows, without putting cathode, without choosing proper current, your patient don't get better. So, as a physiotherapist, you are failed. Not as a student. As a physiotherapist, you are failed. Okay?